Hello, everyone. Welcome to Lung Basics or TCM 101. We are now on our 33rd day. First topic, we have the organ clock. Energy flows through all our meridians all of the time. As such, our 12 exterior channels, or 24 on both sides, have a steady energy flow through them and from one to the other, even now as you are listening to our presentation. But the body can give its maximum concentration of activity and energy to only one meridian at a given moment of time. This is called the peak energy or activity time of this meridian. At this time, the meridian gets more energy and has more activity than any other meridian of the body. Going by the statistics, the commonest time to get asthma attacks is around 3 to 5 a.m. So it is evident that lung energy is affected at this time. This is the peak energy and activity time of the lung. The asthma that occurs at this time is because of excess of yin or yang in the lung. Both energies, they increase in proportion to what there was before. The fact that a lung disease worsens at this time only tells us that there is an excess energy in the lung. It does not tell us whether the yin or yang is high. To know this, we need more information, such as, is the asthma worse in wet, cold weather? Is it bad in the night and in the early mornings? Is there much mucus? This would be a yin-dominant asthma, but if it is worse seasonally, it is an allergic asthma with dry bronchial spasm. And if at other times the patient is perfectly well, this would be a yang-dominant asthma. In order to treat this excess state, we can sedate the yin or yang of the lung accordingly. Pregnant women get morning sickness. Very rarely is it evening sickness. Therefore, something happens to the stomach energy at 7 to 9 a.m. And this is the peak energy and activity time of the stomach. If the patient is sick at this time, one can only say that it is because of an excess of yin or yang. To say which of these two is in excess, we need more information. So if vomiting is the main symptom, it indicates yang excess in the stomach. If nausea is the main problem, this being a passive symptom, it indicates yin excess in the stomach. If the patient suffers from excessive nausea and vomiting, then there is an excess of both yin and yang of the stomach. Least energy and activity time. Say at 4 a.m., all the meridians of the body have the same quantity of energy, but the lung has the most. This would not fit the concept of yin and yang. Yin and yang mean where there is an excess, there must be a deficiency. Where there is a high tide, there must be a low tide too. So when the lung has its excess energy time, another organ must have its lowest energy. This organ would be on the opposite side of the clock, the urinary bladder from 3 to 4 a.m. The urinary bladder yin and yang are on the descent. At 4 a.m., the urinary bladder is at its lowest energy. From 4 a.m. to 5 a.m., the energy gradually returns into the meridian. If a patient suffers with low backache and usually wakes up from sleep between 3 a.m. and 5 a.m. with pain and cannot fall asleep again until after 5 a.m., this is because the urinary bladder is deficient. The backache is a yin type or yin dominant of pain because it occurs during rest. Therefore, this is caused by yang deficiency of the urinary bladder. The urinary bladder meridian has its peak energy and activity time at 3 to 5 p.m., and the lung has its lowest energy and activity time at the same period. If one feels very tired and low around 3 to 5 p.m., this is caused by either a yin or yang deficiency of the lung. Symptoms improving at maximum energy time. Symptoms due to deficiencies can improve at maximum energy time as well. Example, a patient is always tired, but around 3 to 7 p.m., his energy is the best in the day. What is special about 3 to 7 p.m.? This is the highest energy time of the kidneys and the coupled organ, urinary bladder. During the whole day, these meridians have little energy, but at their best time, they have more energy, thus making the patient feel more energetic. Parang nakaka-relate ako dito. What should we do for the patient to have good energy constantly? We should tonify kidney and urinary bladder. I no wonder, okay. We should look for symptoms such as dryness, urination to judge whether the yin or yang are deficient so that we could increase this aspect. When this is not clear, we can tonify both. Whenever we notice that the symptom worsens at a particular time, we should check to see whether this time is either related to the peak energy time or least energy time of this organ. If it is related to either of these, this information can be used to decide if it is an excess or deficiency of the organ and whether we should tonify or sedate it. Thank you very much for listening. Let us now call on Ma'am Teresita Sumile to discuss the influential points. Good afternoon, Ma'am Teresita Sumile. Straight from Rizal.
Good afternoon po, Doc. Good afternoon, Doc. Good afternoon, everyone. Now let's talk about influential points, the master points. 8 influential or master points. REN 12 is for yang or hollow organs. Liver 13 for yin and solid organs, yin or solid organs. REN 17 for respiratory organs. GB 34 for muscles and tendons. Lung 9 for blood vessels. GB 39 for marrow. UB 11 for bone. And UB 17 for blood. These points treat groups of organs with similar functions and are very useful additions to the treatment. For instance, it is customary to treat all arthritis patients with points UB 11 and GB 34 to support the joints. Older patients with arthritic problems are also given GB 39 for possible osteoporosis. GB 39 is given for problems of both brain and bone marrow. It can be used for the treatment of anemia along with UB 17, the influential point of blood. Then GB 39 is the point of choice in the therapy of neuralgia, paralysis, neuritis, and nerve atrophy. REN 17 is used for problems of the respiratory system and also the skin. The skin is our third lung. All skin diseases, diseases of nose and throat, asthma and acute and chronic lung infections are treated on this point. REN 12 and liver 13 are for problems of yang or yin organs and should not be confused with yin or yang diseases. For instance, chronic diarrhea with abdominal pain can be treated with REN 12. Problems with the heart, liver, or kidneys are treated with liver 13, regardless of whether these symptoms are yin or yang dominant in nature. Lung 9 is very useful in arteriosclerosis, venous disease, varicose veins, and others. Now we have cookbook or combinations of points. One can make easy point combinations using the above-mentioned simple rules. Some examples are as follows. So we have case number 1, headache on side of head with vomiting. For local points, use GB8 extra 2, 1 local point. Area distal point, use Li4. Then meridian distal point, use GB41. Symptomatic points, GB20 for headache, Pericardium 6 for vomiting. Influential points, GB34 for tension headache, and GB39 for neuralgia type headache. Case number 2, pain in stomach with nausea and distension. For local points, use 13 REN 12 and stomach 21. Area distal point, use pericardium 6. Meridian distal point, use stomach 36. Symptomatic points, use stomach 25 for distension, pericardium 6 for nausea, and influential point, use REN 12 for young organs. To these point prescriptions, you should now add the energy balancing points. Yun lang po. Thank you so much for your attention.
Thank you very much, Ma'am Teresita. We now go to the third topic, still on needling techniques. And let's call on Ma'am Needs You, certified acupuncturist of Silang, Cavite. Good afternoon.
Good afternoon, Doc Hector. Good afternoon, everyone. So the topic for today, needling technique, day 8. Okay. Extraordinary therapies. The extraordinary therapies used with needling are very much part of acupuncture. Moxibustion. The Chinese terms for acupuncture is Jianyu. Jian means needle and Yu means burning. Moxibustion forms 50% of acupuncture treatment. And although we live in an age where we could use infrared light and hot packs to warm pain areas, and we enjoy much better central heating system than in ancient China, moxa still has a place in acupuncture therapy and one that has no parallel in Occidental medicine. Okay. Artemisia vulgaris is the main herb used in moxibustion. The leaves are dried in the sun for several days and crushed at the end of each day. The end product, moxa wool, can be used in many ways. The main purpose of this treatment is to warm an area, meridian, or organ, remove stagnation and blocks due to cold and damp, and restore energy flow. There is a great need for moxibustion in the cold and damp Western countries, especially in the winter months. Okay. Next po. In what ways can moxa be used? Direct moxibustion. In the past, this method was quite common. The therapist picks up a small amount of moxa in their fingers, about the size of a grain of rice or a bean. He sticks it on the skin with some balm and lights it with an incense stick so that it will burn slowly. It can be used for causing scars, which is called scarring moxibustion, which is used then to specialty treatment for seasonal asthma or hay fever sa mga may asthma. This method is not so popular nowadays, even in China. The other way of using moxa is to remove the moxa from the skin when it gets hot, which is called non-scarring moxibustion. This method is used when hitting a single point. One could use several cones per treatment. It is quite time-consuming and requires the therapist to stay near the patient for some time. Okay? Indirect moxibustion, ito naman yung very popular. It requires use of some material between the moxa and the skin. Freshly cut, thin slices of ginger or garlic, about an eighth of a centimeter, prick with a needle to make them porous, make an ideal conducting agent, as ginger and garlic are spices that stimulate the lung and the skin. This greatly increases the effect of moxibustion. Ginger moxa is by far the most commonly used. The ginger slices containing the moxa wool are lit in several spots, can be placed on bakshu points or on the due meridian and moved to another point when one area gets too hot. Okay, yan po yung drawing. Okay? Indirect moxa is used sa cold when there is cold diseases in the organs, usually sa back shoe points. On local areas in cold or damp skin disorders katulad ng warts and vitiligo. Sa do-meridian moxa naman, snake moxa para sa cold sa whole body or when back is weak or in kyphosis. Okay. Thank you very much for your attention.
Thank you very much, Ma'am Needs. Let's now proceed to Earth Element, Part 8. Stomach yang dominant. His worry eats him. Okay, there are young warriors and yin warriors. The young warrior has an increase of stomach yang when he worries. Their stomach becomes tensed and secretes more acid when they are worried about something, and they cannot eat or might vomit if they eat. These are the active warriors. They have to do something immediately about their worry. They also expect others to take part in the doing. It is only when they have finished solving the problem, it could have taken 3 whole days, when they will realize that they have not eaten anything during this time. Naturally, they end up with gastritis, gastric ulcers, and seem to lose weight if they have worries. The stomach yin dominant, he eats his worry. The yin warrior is a passive one. They have yang and qi deficiency, and they do not wish to do anything about their worries. They will wait for someone to solve their problems. They will go from doctor to doctor until someone says that they will solve their worry for them. In the meantime, they talk to everyone they can about their worry over a cup of tea and a piece of cake. They gain weight during the period of worrying. Now let's talk about OCD, or obsessive compulsive disorder. OCD can be active or passive. So at this point, we refer to patients with active OCD. They often repeat certain actions and they have no control over this behavior. Mostly, they either arrange everything in some order, clean or wipe furniture, or wash themselves. These actions never seem to end or achieve a satisfactory finale, and they need to repeat them again and again. They're unable to stop even if it makes them tired or late for school or work. This is an active worry, but has no real solution like the young worry. It is an action with no beginning or end, like a dog going round and round to catch its own tail. It wastes much energy and achieves nothing. This is a leakage, a yin and yang deficiency of the stomach, and blood and qi deficiency of the spleen. There is little yin, but the qi cannot contain it. Therefore, the picture of leakage, like a glass with very little water, but the bottom is full of holes through which the water leaks, causing a greater loss in the yin. Thank you very much for your attention. Now let's talk about treatment and disease prevention principles. Balancing the yin and yang. In ancient Taoist texts, Wu Wei is associated with water through its yielding nature. Water is soft and weak, but it can move earth and carve stone. Emotions respond to environmental stimulation. Keeping a favorable emotion and facing life optimistically are indispensable cultivation. It is the main factor of good health and longevity as well. So dapat maging very positive tayo always. Next, we have to exercise nurturing. Qigong relies on breathing techniques to direct the qi to different parts of the body. The relationship among Qigong, acupuncture, and massage, the tuina, are quite close as they are all based on the same theory. Taoist and Buddhist priests introduced the importance of cultivating the dantian, or the inner elixir. Another form of therapeutic exercise is Tai Chi, in which the person moves through a series of 24 to 64 movements that require a relaxed body and correct rhythmic breathing. Many Chinese practice Tai Chi as a form of preventive medicine. Number 3, dietary and medicinal nurturing. Increase the good qi and to avoid the violation of bad qi. We can use natural herbs, Chinese herbal chicken soup, Chinese herb tea. Environmental nurturing. Chinese people always stress the harmonious relations between humans and nature. The Chinese ancient art of feng shui, geomantic omen, is a theory and art aiming at looking for a good environment for prolonging life and promoting health. Sexual intercourse nurturing is number 5. Yin Yang is the law of nature. Ancient Chinese people thought of nature and themselves from the aspect of yin and yang. And the Oriental philosophy considers that male and female, yin and yang, heaven and earth are in the union. The way of yin yang is the core of sexual love, and it is the main need in human life. The harmonious and moderated sexual life will make one happy, improve health, and prolong life. The competitive advantage of TCM restores and adjusts the balance inside our body with a holistic way. We use pattern identification as diagnostic methods, explore the potential of the human body by good qi. All treatments are followed by self-regulating, self-repair principles. The Chinese medicine believes that medicine is a kind of harmony between man and nature. Integrated medical model looking for ecological balance. Now, the restriction or limitation of Western medicine. Those incurable diseases and diagnosis cannot be confirmed by any examination, like dizziness, fatigue, palpitations, insomnia, fever of unknown origin, or some people who get drug allergies from side effects or drug resistance. So application, we have low back for TCM, low back pain, allergies and asthma, arthritis, gastrointestinal diseases, depression, irregular menstruation. Most popular treatments are massage, acupuncture, medicinal herbs, or spinal therapy. Thank you very much for your attention. We now proceed to Zangfu organs, and let's call once again Ma'am Needs You for her presentation. Good afternoon po ulit, Ma'am Needs.
Good afternoon, Doc Hector. Medyo maingay lang ang aso. Pasensya na. So the topic is pathology of the heart. Okay. Deficiency patterns, heart qi deficiency, heart yang deficiency, heart blood deficiency. Sa excess patterns, stagnation of heart qi, stagnation of heart blood, heart fire, phlegm cold in the heart, phlegm heat in the heart. Okay. Let's go to heart qi deficiency. It is the initial stage of heart yang deficiency. Okay. Cardinal symptoms, palpitations with fatigue, shortness of breath on exertion, listlessness, lacking the joy of life, spontaneous sweating. Okay. Let's go to heart yang deficiency naman. It is the result and further complication of heart qi deficiency. Relationship between heart and lungs can also cause symptoms pertaining to the lungs. Okay. Cardinal symptoms, symptoms of heart qi deficiency. Additional symptoms, feeling of constriction in the heart area and cold hands. Okay. Stagnation of heart qi causes qi to stagnate in the thorax. Okay. Cardinal symptoms, palpitations with feelings of constriction in the thorax, depression with feeling of oppression, unable to express emotions. Yan po. Heart blood deficiency, it is the initial stage of heart yin deficiency. Okay. Cardinal symptoms, palpitations, difficulties falling asleep, decreased short-term memory, slight restlessness, and pale lips. Okay. Heart yin deficiency is the result and further complication of heart blood deficiency or initial stage of heart fire. Okay. Cardinal symptoms, symptoms of heart blood deficiency. Additional symptoms, frequent waking at night, more restlessness, heat sensation, night sweat, and 5-center heat. Okay. Heart fire, result and further complication of heart yin deficiency. Okay. Cardinal symptoms, palpitations with heat sensation, hectic unrest and restlessness, ulcers in the mouth, tongue ulcers, stomatitis, fast speaking, endless talking, mabilis magsalita, and aversion to heat. Okay? Stagnation of heart chi causes the chi to stagnate in the thorax. Sa thorax pala. Okay? Cardinal symptoms, palpitations with feelings of constriction in the thorax, depression with feeling of oppression, unable to express emotions. Okay? Stagnation of heart blood causes obstruction of the vessels combined with repressed emotions. Stagnation of heart blood. Cardinal symptoms, palpitations with strong feeling of oppression in the thorax, stabbing pain in the area of the heart, cyanotic nails, cyanotic lips. Yung cyanotic color violet or purple. Okay? Let's go to phlegm cold in the heart. The phlegm obstructs the heart orifices and affects the mind. Cold in combination with phlegm can cause mental disturbance. Okay, parang baliw. Okay, cardinal symptoms, palpitation, stupor, unresponsiveness, absent language function, talking to oneself, autism, confusion, mental depression, staring at walls. Ayan, pag nakakita po kayo niyan, meron ng phlegm cold in the heart. Okay? Phlegm heat in the heart naman, the phlegm constructs heart orifice and affects the mind. Heat in combination with phlegm can cause mental disturbances and agitation. Okay? Cardinal symptoms, palpitations, mental restlessness, confusion, mental depression, talking to oneself, nakausap ang sarili, absent language function, incoherent talk, stupor, unresponsiveness. Okay. Sana po marami kayo naintindihan. Thank you very much for your attention.
Sana hindi kayo nakaka-relate.
Maganda yan, Doc. Maganda yung topic.
Okay. Yes. So maraming salamat po, Ma'am Neets. Let's now go to meridian theory as usual. Let's listen to Ma'am Teresita Sumile for a continuation of our discussion of the kidney channel of foot Shaoyin. Good afternoon po ulit, Ma'am Teresita.
Good afternoon, Doc. Good afternoon, everyone. Let's continue our study on kidney channels. Now let's go to kidney 1, kidney 10. Location at the medial end of the popliteal crease between the tendons of the semimembranous and semitendinous muscles at the level of the knee joint space. Point is the water point of this water organ. This is the very strong kidney tonification point. If given too often, patients could start feeling cold and heavy and complain of stiffness in joints. It is very close to point number 8 and needs to be differentiated carefully. Kidney 11 to 21. Location at the upper border of the pubic symphysis, 0.5 tune lateral to the anterior midline. Kidney 12, 1 tune superior to the upper border of the pubic symphysis, 0.5 tune lateral to the anterior midline. Kidney 13, 2 tune superior to the upper border of the pubic symphysis, 0.5 tune lateral to the anterior midline. Kidney 14, 2 tune inferior to the umbilicus, 0.5 tune lateral to the anterior midline. Kidney 16.5 tune lateral to the center of the umbilicus. It is used for helping contraction of the uterus following childbirth, which is beneficial for controlling bleeding. Kidney 17, 2 tune superior to the umbilicus, 0.5 tune lateral to the anterior midline. Kidney 18, 2 tune, 3 tune superior to the umbilicus, 0.5 tune lateral to the anterior midline. Kidney 19, midway between the sternocostal angle and the center of the umbilicus, 0.5 tune lateral to the anterior midline. Kidney 20, 5 tune superior to the umbilicus or 3 tune inferior to the sternocostal angle, 0.5 tune lateral to the anterior midline. Kidney 21, 2 tune inferior to the sternocostal angle, 0.5 tune lateral to the anterior midline. Kidney 22, in the 5th intercostal space, 2 tune lateral to the anterior midline. Point explanation. These points are on the abdomen and are used as local points. They are also good points for descending water from the abdomen or as in ascites in order to increase urination. They are also common points in the extrameridian. Kidney 22 is the exit point of the meridian where it flows into the next meridian, the pericardium channel at point pericardium 1. Often, especially after breast surgery, the connection between these meridians is blocked, and this may cause severe pain in the area. This could be treated by needling the part of each meridian which is still left and sedating the needle on kidney meridian. This will bring about a reconnection of the energy flow and reduction of pain. Kidney 24 to 27. Kidney location, kidney 24, and the 3rd intercostal space, 2 tune lateral to the anterior midline. Kidney 25, in the 2nd intercostal space, 2 tune lateral to the anterior midline. Kidney 26, in the 1st intercostal space, 2 tune lateral to the anterior midline. Kidney 27, at the lower border of the clavicle, 2 tune lateral to the anterior midline. These 4 points should be needled towards the sternum at a 10-degree angle. Point explanation. The last 4 points of the kidney meridian are used to treat lung edema or excessive mucus. They help the lungs to descend the water down to the kidneys. Yun lang po. Thank you so much for your attention.
Thank you very much, Ma'am Teresita. We now come to the last topic for this afternoon. We are still on chest painful obstruction, patterns, and treatment. Another case history. We have a 66-year-old man complaining of a feeling of oppression, tightness, and mild ache in the chest. This had started over 20 years previously with recurring sudden panic attacks characterized by breathlessness and an intense feeling of oppression in the chest, like a band around the chest. He also had the feeling he wanted to sigh but could not. 2 years before the consultation, he had also suffered a mild heart infarction. He felt occasionally dizzy and had recurrent bouts of a stabbing hypochondrial pain on the right side. His face was pale and his tongue was bluish-purple on the edges and pale elsewhere. It was swollen and had a very sticky tongue coating. His pulse was slippery. This man's condition is characterized by turbid phlegm obstructing the chest, feeling of oppression, tightness of the chest, breathlessness, dizziness, swollen tongue with sticky coating, slippery pulse. Besides this central condition, there is also some stagnation of liver qi, which is feeling the need to sigh, and liver blood, stabbing, hypochondriac pain, and bluish-purple color of the tongue's edges. The condition is characterized by cold, as evidenced by the pale tongue and pale face. Despite the very long duration of this problem, 20 years, the condition was still primarily one of excess, as evidenced by the pulse. Attention was paid to resolving phlegm, moving qi and blood, and expelling cold. The herbal prescription chosen was aimed at resolving phlegm as a primary objective, while with acupuncture, some points were reinforced to tonify the body's qi. So both acupuncture and herbs were used. With acupuncture, some points were needled with even method. Pericardium 6 to move qi and blood in the chest and relieve the feeling of oppression and tightness. Stomach 40 to subdue rebellious qi in the chest and resolve phlegm. GB 34 to move liver qi in the hypochondrium. Liver 3 to move liver qi, calm the mind, settle the ethereal soul. Ren 17 and bladder 14, the front mu and the bakshu point of the pericardium, respectively, to move the qi in the chest and relieve the feeling of oppression and tightness. Liver 14 to move liver qi. Spleen 6 to help resolve phlegm and calm the mind. Spleen 4 on the left and pericardium 6 on the right to open the penetrating vessel. So we have a male patient, so unital spleen 4 on the left, followed by the left pericardium 6. This vessel, the penetrating or Chung vessel, is excellent to remove obstructions and subdue rebellious qi in the chest. Some points were needled with reinforcing method to tonify the qi. Stomach 36 and Ren 12 to tonify spleen qi to resolve phlegm. This patient showed a very marked improvement after a short time, with most of his symptoms disappearing or being greatly reduced in intensity. Thank you very much for your attention. We hope that you could join us again next time for the next presentation.